Well, the Food First programme started in 2009 when the medicines management team locally recognised that there was a problem with the cost of prescribed oral nutritional supplements. They were increasing about 11% year on year, both locally and nationally, and they wanted to look at switching to a cheaper product that would maybe be about half the price and a complete switch in that way. We recognise that not everyone would want to switch and may not be a suitable product for everybody, and we suggested that if they would like to skim off the saving we thought we could save them, which was approximately 20% from their budget for the next year, we would put into place a training and education programme that would look at tackling the underlying reasons why people were requiring the oral nutrition support and hopefully have a sustained reduction in the spend rather than a one-off quick hit. That's happened, and what we've done is worked very closely both with social and healthcare locally, and the work has expanded across 2 CCGs as the cost savings has been realised, and they've looked at wanting to have that in their area, the GPs as well. So the training and education looks at individualising the care that people at risk of malnutrition receive and ensuring that there's a rigid structure to actually assessing what people need so that their needs can be met appropriately. One of the biggest challenges about setting up the Food First programme was that we were trying something that was different from what the main profession were recommending. So there isn't a lot of evidence about using food to manage malnutrition, and the reason for that is because a lot of the research has been completed by the drug companies who've got the funding. However, we all know that if we eat more than we need, we will get bigger. So it's been about actually stepping outside of what the norm is, collecting our own outcomes and proving to the rest of the profession that actually what we were saying and believed in is actually right. And because there hasn't been so much support within our own profession, one of the things has been to really stick with it, to maintain that belief and keep going, whereas it's quite easy otherwise to kind of buckle under the pressure and go back to the norm, which may not actually be the best thing for our patients. Well, with the NHS being limited with resources, you have to really demonstrate what value you will be adding if someone's going to spend some of their resources on you. So when we asked medicines management to top slice some of their budget, we ensured that we included what extra we would also offer from that. So if you improve nutritional status, you also reduce pressure ulcers, falls and admissions to hospital, and we've always made sure to emphasise those points because that's an additional saving that you wouldn't get if you just switch to a cheaper product or something like that. What we also have done is made it quite clear what our costs will be. We've stuck to them and achieved the savings that we've needed to, and in fact in excess of the potential predicted savings initially. And having then recruited a strong team, we've been able to look at changing the way that other people work in order to be more efficient and effective, and really putting our service users at the centre of what we're doing so that we can be more proactive rather than reactive, and actually save some money hopefully that way as well. As a team, it's been really important to have a range of bands, because it can be very easy to focus it all on specialists at the top who are very expensive, but you don't get much time for your money. So once we'd had the initial startup of the project, in order to make it a sustainable programme, we've looked to recruit people through the bands from band 4 up to band 7, with the focus being on the lower bands to ensure that we've actually got people there to provide the service, rather than it being people who sort of going around, going to meetings and not actually doing the legwork, as it were. And I think that has made us a more cost-effective service than perhaps some of the other similar programmes that are running around the country. I think the best thing about the NHS is there are some really inspirational leaders out there who get out there and are telling people about what they've achieved in their areas, and also are very supportive of the fact that there are frontline staff who have ideas and that they can be developed into something that's really quite transformational. The area the NHS could perhaps improve on is looking longer term. We've had a lot of short-term funding, which has meant we've lost a lot of staff who really want things like mortgages and the job security. And actually it's quite hard to show outcomes in a short space of time. So a little bit of longer term thinking and longer term budgets would be more useful, perhaps over 3 years rather than 6 to 12 months.